99.3 Nigeria Info. Let's talk.
Be a part of conversations that affect you, mothers, as well as your child on Maternity Line show, where Zainab unearths motherhood through unique stories in reproductive health.
Pregnancy is quite challenging for me. For the first pregnancy, I had to deliver at 32 weeks.
I hit my tummy on the COVID and immediately I was rushed to the hospital.
How about asking questions that benefit your child, babies, and toddlers?
Immunization for children has a lot of benefits. You vaccinate your child till the 15 months. Most parents stop at 6 months when their babies stop breastfeeding.
On the show that features experts and professionals across maternal and child health, join Zainab as she amplifies voices of women for better physical, mental, and social well-being. We discuss parenting.
My kid is a bit older now. When he was younger, it was a bit more stressful, but now we kind of work with each other.
My name is Ugo. Thank you for bringing up this topic. So I'm a single mother.
And even hand the mic over to allies who are men and fathers, creating better outcomes for child and maternal practices. Join Zainab Fridays 12:15 p.m. on 99.3 Nigeria Info on Maternity Line show, an all-encompassing medium for every woman, mothers and intending mothers.
Lagos, good afternoon. Welcome to Maternity Line Show on your number one talk news and sports radio station, 99.3 Nigeria Info. Happy new month to you. And yes, it's July already, and I'm wondering, wow, I can't believe how fast 2025 is moving. This is amazing as we begin the month of July. And of course, the second part of the year, I want to take a moment to thank you for staying with us on this journey. Of course, the journey of advocacy, the journey of awareness and support for women, mothers, and of course children across Nigeria, of course beyond Lagos. All right, and for the years for the rest of the year 2025, may every dream, every of your dream you've carried in your heart, just like a mother carries a child, find accomplishment, expression by the grace of God. Okay, let's walk through the month together, informed, inspired, and intentional. We can do it. Okay, yes, welcome to Maternity Line Show. I am Zainab, you already know that. Okay, and today we are putting a spotlight where it matters most. You know what I mean? I bet you don't want to miss out of this conversation, because the conversation today is not only to benefit the pregnant women. Okay, it is to benefit every father listening to me right now, every husband listening to me right now, every sister, neighbor, or caregiver. So it's even for our market women in Mushi, in Badagry, in Ikorodu. So it's an interesting conversation we are having today. And guess what? What's the conversation? The conversation is health insurance towards reducing maternal mortality in Lagos. You know, when it comes to issues like this, you know, I'm big and vocal on this. And then you've always been wanting to ask questions about Ilera Eko. Guess what? LASHMA is live in the studio. Bring all your questions. And guess who is live in the studio with me? I have the Honorable, should I mention her name yet? Okay, I will. Let me give you. She's Dr. Emmanuella Zamba, the Permanent Secretary, Lagos State Health Management Agency, LASHMA. She's a multilingual who speaks fluent English, Yoruba, German, and conversational French. I wish I could just say bonjour. You know, I'm taking French class. Yeah, she's live with me in the studio. She joined the Lagos State Public Service in 2005 and has served as Director and Coordinator of the Lagos State Health Sector Service Charter Cascade Initiative between 2012 and 2020. 2020, State Health Sector Investment Officer between 2016 and 2018, Coordinator and Health Sector Quality Control Program between 2015 and 2020. And she was also on the board of Lagos State University Teaching Hospital, LUTH, since 2012 and 2013 as the representative of the Lagos State Ministry of Health. It's so much because she has also served as the State Human Resource Health Desk Officer. So the CV is huge. And because of time, we really have all the time on the show. So I just have to keep it short and simple. Do not forget, health insurance towards reducing maternal mortality in Lagos is the conversation. Let me introduce her. And right after this break I'm about to observe, you will hear her speak to us effectively. All right. Dr. Emmanuella Zamba, I feel honored to have you live on the show this afternoon. I must say thank you so much. May God Almighty honor you.
Thank you for inviting me.
Thank you. And also I must say big thanks to Madam Adeyinka, yes, LASHMA PRO. She's been quite helpful. She's my go-to person and she hasn't failed me on this one. I'm grateful to you, Madam Adeyinka. So Lagos, be a part of this conversation. We are going to launch into this conversation fully right after the break. But before then, please be sure of this conversation. Go online on our Twitter page at Nigeria Info FM Lagos, on Instagram at Nigeria Info FM Lagos, and of course our social media, that's Facebook and YouTube, Nigeria Info 99.3. Like our page on Facebook and subscribe to our channel on YouTube. All right, jump on this conversation. Our website is also up and running at www.nigeriainfo.fm. You'll find the ML podcast, that's Maternity Line Show podcast, on there, and several other show. Let's have your questions. The number to send your question is 0809 597 5805. That's the WhatsApp number. So start sending in your question. Okay. Recently, the Lagos State government and the National Health Insurance Agency announced a new partnership among several other partnerships that the Lagos State government and the federal government has been signing towards ensuring that maternal mortality is brought to zero in this part of the country. Lagos, I'll be right back right after this time. Please don't go anywhere.
More talk, more right after this. This mid-year, the Solar World Electric Technology Limited is giving you more than just power. We are giving you comfort. From now till the 25th of July 2025, when you purchase a complete solar package of 5 kVA and above, you'll receive a free inverter air conditioner. Yes, absolutely free. Here's how it works. Buy a 5 kVA to 7.5 kVA complete inverter and solar system and get a 1 horsepower inverter air conditioner. Buy a 10 kVA inverter and solar system and get a 1.5 horsepower inverter air conditioner. Buy a 15 kVA to 20 kVA inverter and solar system and above and get a 2 horsepower inverter air conditioner. You can install it at home, use it at your office, or even give to your friend or family. The choice is yours and the value is real. Don't wait till the heat kicks in. Call us now or message us today on 0906 331 5492 and let's get you powered and cooled in one smart move. Visit our office on number 26 Emmanuella Zamba Cole off Fola Oshibo Street, Lekki Phase 1, Lagos. Solar World Electric Technology Limited, redefining the limits.
This is not just a debate. It's a battle of minds. A clash of brilliance. A war of words. And only one champion. One true champion will rise. The regional champions are ready. The stage is set. The stakes higher than ever before. Catch the I Beg to Differ National Finals live on all Nigeria Info FM and Kids FM stations nationwide. It's intellect, it's passion, it's the future in action. Debate redefined. The IBTD National Tournament begins August 11th, 2025. Only on Nigeria Info FM and Kids FM nationwide. For sponsorship, call 0805-581-5844 or email ibegtodiffer@nigeriainfo.fm. I Beg to Differ, the Tournament of Champions.
Welcome back to your number one talk, news, and sports station. This is Nigeria Info.
Nigeria Info.
This is
Maternity Line.
Maternity Line.
Lagos, join the conversation. It's 28 minutes past 12 o'clock from our live studio located on 267A Etimi and Crescent, Victoria Island. That's where we are. The conversation is, as I told you earlier, health insurance towards reducing maternal mortality in Lagos, Nigeria. And just before the break, I did introduce my guest, Dr. Emmanuella Zamba. Okay, and I spoke a bit about the newly announced Lagos State Health Management. I was going to say the permanent secretary of LASHMA, Dr. Emmanuella Zamba. Yes. So I did touch on the newly announced health insurance towards reducing maternal mortality in Lagos recently by the National Health Insurance Authority, which has now partnered with the Lagos State government to ensure the prevention of maternal mortality in the state and Nigeria at large. And I'm going to be quoting the Lagos State Commissioner for Health, that's Dr. Akin Abayomi, where he was talking recently. He stated that this partnership aims to achieve zero maternal mortality, even though the figure in Lagos is not too high compared to other states. Yes, of course, we all know that Lagos State government is doing impressively well when it comes to the issue of public health and, of course, maternal mortality. I mean, yes, I've had Dr. Kemi, the essay to Governor Sanwo-Olu on the show. Yes, Dr. Kemi Oyeyemi was on the show last year, you remember. So come through with your question once again as Madam Emmanuella, Dr. Emmanuella is about to start speaking right now. Okay, now let's get to it. Doctor, I don't even know where to start, but I will start anyway. Dr. Zamba, let's start with this newly announced partnership. I understand that LASHMA is the implementing body of the Lagos State Health Insurance Scheme, Ilera Eko, and since the NHIA and Lagos State government aims to provide financial protection, I understand all of that, and maternal health coverage for indigent pregnant women in Lagos. I believe LASHMA would be involved in this. Am I correct?
Definitely.
Aha, fantastic. Now, so does that mean that with this partnership there is free care for women even if they don't have money? We need to clarify that.
Okay. I think there are three parts to your question. The first one I'd refer to is to do with the partnership with the National Health Insurance Authority. That specifically targets indigent women that have emergency situations in pregnancy.
Oh, great.
It's called the emergency, we call it EMONC, but I don't know what the full accolade is. However, what it is really is that they partner with general hospitals, especially in Lagos State. They would undergo some level of accreditation, etc., by NHIA, and then they are now designated as points for women, indigent women who have emergency conditions. So they come into the hospital, and because of this arrangement, they are immediately treated without asking for any funds whatsoever, as long as they have been profiled and found to be indigent. Which means that they are vulnerable and they can't afford any care. They will be treated under this program. And once the treatment is sorted and the lady is fine, the bill is sent to NHIA. The claim is sent to NHIA by the hospital, and NHIA remunerates the hospital or reimburses the hospital for the service that they rendered. The role that LASHMA plays in this is that once that lady has been stabilized and so on, Their names are sent to us in LASHMA, and they are now to be enrolled under the Basic Healthcare Provision Fund, which is something that the federal government is doing with all states in Lagos State. That is, the lady as well as her household would be enrolled under the Basic Healthcare Provision Fund. So that's where we come in. Their names are given to us and we enroll them. And of course, subsequently, they are able to choose a facility to go to and they start accessing care.
All right. So does this include or exclude, or let me say, is this mainly for indigent pregnant women who are already registered for LASHMA card?
I won't say I can speak to whether it's LASHMA card or not, as long as you are pregnant and you walk into that facility and you need urgent care, you will be taken care of. I assume that, in the course of the treatment, they would be given LASHMA ID, definitely before they leave the facility. But to say that it's an emergency, so in an emergency, you're not supposed to ask for documentation, etc. Save the person's life, and then you can ask for, or ensure that that person now gets a LASHMA ID and is also enrolled on health insurance.
Save the person first. Did you hear that? Talo sọ pé Èkó ò ṣe nǹkan, Ilera Eko. I mean, yes, Lagos, this is an opportunity for you. The Ilera Eko you've always been talking about, I don't understand, is that when we go to the hospital, it's your time to call in and ask right now. Dr. Emmanuella Zamba is live on Maternity Line show. Now, let's move it. Doctor, you've previously quoted a maternal mortality rate of about 430 per 100,000 births in Lagos. Have there been early signs of progress since this partnership was announced? I know it's still very recent, yes.
And we are yet to fully roll it out. So no, we won't be able to I would still take the 430 as the baseline.
Great. Okay, now, which pregnant women qualify under the scheme? And what is the step-by-step process for enrollment?
Okay.
Because when they are going, are they supposed to go with a passport photograph or stuff like that? Usually there are requirements, I suppose.
Okay. So the Ilera Eko program is for everybody in Lagos. It is an inclusive program because it is a social health insurance program. And what that means is that as long as you reside in Lagos, you work in Lagos, you are entitled to come under the umbrella of the Ilera Eko program. And that does not exclude pregnant women. So what we expect from you really is that you come enrollment. Now, you can enroll either going through our website, which is www.lashma.com, or you can make phone calls to our call center and they will walk you through what you need to do. The call center is 24 hours. You can walk into our divisional offices. We have 5 divisional offices across Lagos State. We have 14 subdivisional offices and we have 16 kiosks and growing. You can also register through USSD, which is *6700 *006 hash. You can also do that. Now, what do you need to come on board? We have 3 different plans, but for someone that is pregnant, there are only 2 plans that are applicable, and that is the family plan for a family of 4, which is at 55,000, and that is husband, wife, and 2 children. And then there is also the family of 6 plan, which is 80,000 naira, and that is for husband, wife, and 4 children. The children must, of course, be under the age of 23.
Okay.
And so once you come on board, whatever route you use, you will have to give us their biodata. We will need to know the name, your full name. You give us 2 of your names and your surname. You will need to show some level of evidence to show that you are indeed residing in Lagos. So if you do not yet have a LASHMA ID card, we allow you to bring one of your utility bills, and that can serve as evidence that you are living within in Lagos. Once you're able to do that as well, of course, we do ask for passport photographs. But
great.
If you do not have passport photographs, because we are IT enabled and they're usually enrolled through either the enrollment officer's phone or tablet, or as I said, you go online directly to do that. They can take a photograph of you and upload that on your behalf if you didn't come with a passport photograph. And then once you've done that, the bill, you will get a policy ID, and then you go ahead and you make your payment. There are various payment channels that you can use. We do not collect cash. It is a 0 cash policy. and we do not allow you to transfer to any of our agents.
Oh.
You must pay through the accredited payment channels.
Nice.
You can use InterSwitch. We have e-bills. You can go into the bank. We have UPS, and we're trying to expand that as well. The various modalities. As I said, you can go on USSD to also make your payments. You can walk into the divisional office. There are POSs that you can use to make your payment, and it automatically drops into the Lagos State Health Fund, which is the pool of funds for premiums. And once you've done that and you've made your payment, you must have paid before the 25th of the month.
Okay.
Because
Every
of
month?
administration. Yes.
Okay.
So once you paid on or before 25th, you will be able to access care from the 8th of the following month if you go to the hospital.
Okay.
We need a little bit of time to rationalize your payment, ensure that your name is on the list that's going to the hospital that you've chosen. Let me just talk about that as well. The choice of the hospital is yours to make.
I was going to
We
ask.
do not dictate that. We have both public and private hospitals that you can pay every month. So we have providers adding onto the list, and if we have providers that have been naughty, you do have the liberty of changing your hospital twice a year, but you cannot do it more than twice. So people move around a lot. So you could have moved from your previous area of residence to another area. You can send us an email or make a call to the call center and explain your reason for wanting to change the facility, and it will be done for you from the following month. The reason why we ask the question is because we need to ensure that our providers are doing what they are. So we don't want to, for instance, you tell us that it was because you were treated shabbily or whatever, that hospital is going to be queried. It's just to ensure that, we keep this cycle of quality services going.
Thank you so much for all that have been said so far. Still on this partnership, before we move over more for question on LASHMA. I remember going through that announcement, the report of that announcement again. And speaking of hospitals, that you mentioned that, okay, so you have that luxury to choose your own hospital as a woman, a pregnant woman, a vulnerable. Yes. So now I remember part of what the commissioner was saying. He said with this program, Lagos State is committed to identifying vulnerable pregnant women who cannot afford to pay for themselves and helping out. And he also did state that there are few pregnant women living in rural areas such as Ekpe, Badagry, that this program is to identify them and pick them early. And I'm curious to ask that, does this mean that those locations
coverage and sourcing for funds to be able to cover them, which is called the Eco Social Health Alliance, EcoSha. Mr. Governor has graciously been a very supportive governor, and he has not only he has put his money where his mouth is. Indeed, now we have the equity fund, which is 1% of the consolidated revenue fund, that is set aside and given to the agency to provide cover for vulnerable people. That has now become a first line charge, and it has even been increased by 200% this year, from 1 billion to 3 billion as allocation. So we do have a set of field officers living within communities in local government LCDs across Lagos. We currently have a field force of, I think, about 36 and counting, and we continue to expand. And they are the ones responsible for identifying vulnerable women, vulnerables in the business of in any local government or any LCD. We have a computerized means testing tool that we use to be able to objectively assess if this person is indeed financially challenged or not. Yeah?
Yes.
So once you have been identified as someone that is truly vulnerable, they do register you and your family members, and your name is sent to LASHMA. And by the end of the month, when we are collating names to the hospitals, their names will be added on, and LASHMA goes ahead to pay for them from the equity fund. So they are entitled to the same set of services that someone that paid from their own pocket for the premium is also entitled to.
Thank you, Dr. Elizabeth Zamba, Emmanuella. Sorry, Dr. Emmanuella Zamba, for all the good works you are doing at LASHMA. I've done my research. I see a few of them, and it's impressive. I also understand that since inception, LASHMA launched several initiatives to support pregnant women, and that's very personal to me, I must say, as far as this show is concerned. There is one called Mom Care Project, which focuses on reducing maternal mortality, providing access to quality health care from inception, and all of that. I mean, such initiative is something to be spoken about, especially if people are not aware. So apart from this Mom Care, are there other initiatives that people need to be aware of? This is me asking.
You're asking particularly for pregnant women, or you're just asking
for
generally?
Pregnant women?
Okay, so I'll just speak to the services that we have. You're entitled to antenatal care. Once you've made your payment, you're entitled to antenatal care, and you visit the hospital as and when due. Your ultrasound scan is done free. Your blood test will be provided free of charge. And then once the doctor has decided whether it's a normal vaginal delivery or cesarean section, that is also covered under the scheme. You will also be entitled to admission, is also paid. If you need blood transfusion, we also pay for 2 blood pints of blood under the scheme. And so generally your entire cover from once you come in until you have that baby, there is very minimal that you're going to have to pay. It's usually free. Most women will, except in cases where they had some slight complication that is not necessarily covered under the
initiative,
then they would have to pay. But usually the reports we've heard, people pay as low as 8,000 naira extra and things like that. So it's something that we have deliberately been very, very intentional about that. Maternal and child health is very important. Even after you've had the baby, so the neonate has maybe jaundice or has sepsis, those are also covered under the mother for the first 28 days of life. And so when we now ask you that, once that baby, before the baby turns to day 29, kindly get across to us so that the baby can be added into your plan and care continues. But the care for the first 28 days is actually free under Ilera Eko. And we'll pay for it.
Okay, I love it when I hear free. Even though I understand sometimes, women complain of, we get, they're telling us it's free, they're telling us the only amount you have to pay maybe as low as 8,000 naira, but we still get to the facilities and they're turning us back. So we've had issues like this and complaints like that on the show. Reason I see people dropping messages already, so I'll come to the message. But if you would love to be a part of this conversation, don't leave things for me to be the only one asking on your behalf. We've had this before. We've asked questions in this regards before. The numbers to call 0201-277-0993, 0201-465-7190. WhatsApp 0809-597-5805. Now, we hear cases. Okay, I have a call. I briefly touched on that previously, but let's take this call. Good afternoon.
Good afternoon, ma.
Good afternoon. What's your name and where you calling from?
Hello. My name is Philip. I'm calling from Ikorodu.
All right, Philip.
Yeah, I love the program, but one thing I love most is when your question to your guest this morning about the issue of free. Now when we get there, it will become another thing. So I want your guest, ma, to help me answer this question. Is this scheme going to cover somebody in outside Lagos whose parent is in Lagos, man? And secondly, can someone pay instrumentally before he start accessing that program? Are you with me, ma?
Okay.
Dr. Emmanuella, did you get
I'm not sure I got the first question. I did get the second one. You said if someone is outside Lagos, but their parents...
Yes, the parent is in Lagos and maybe the children or wife is outside. Can they come into Lagos and to access the facilities?
Yes, as long as they come into Lagos, yes, they can access it because you are the principal and those are your dependents, including your spouse. So yes, indeed, they can. Right. As long as you are living here and you have evidence to show that you actually do live here, that is fine. Your second question was around...
Can we pay instrumentally when the money is complete?
we do have two modalities really by which you can pay installmentally. We have our Pay Small Small initiative, whereby you can pay either quarterly, half yearly, depending on how your pocket helps. But it is the people that are pregnant cannot be on Pay Small Small, simply because you are definitely going to draw down on your premium, and you are even going to draw down more than what you paid in the first instance. So therefore, if you know your wife is pregnant, you would have to pay upfront the full amount. If you have just one child and she's pregnant with your second child, you can buy the 55,000. And once that child is born, as I said, as long the child will be covered for the first 28 days, the child will now be added and your plan is complete. If your wife has 3 children, for instance, you would have to buy 80,000 so that when that child is born, the child can be added on onto your plan. So it is free. If you go to our social media channels, you would see testimonials every week. We call it Attestation Monday and Testimonial Thursday, or is it Testimonial Friday? And these are real life people from all walks of life across all the divisions in Lagos State, testifying to the genuineness of Ilera Eko.
All right, Mr. Philip. Any other question? Oh, okay. It dropped off. There is one here from who? No name. She says, or he, please ask your guest who fibroids surgery isn't covered. A lot of women are going through a lot, and isn't it same as CS? I'm trying to make a sense of this question.
I understand. So, yes, myomectomy is not currently covered under the scheme. It is more of a gynecological issue than an obstetric issue. And so we are focusing first of all on maternal and child health, and gynecology issues would come in over time. So the beauty of social health insurance is that as the numbers grow of the number of people that are in and the pool expands, you're able to add on other services that you have found to be very necessary as we go along. So where we started from in 2020 is not where we are now. We've added things along the way like glasses, dental care, we've added cancer care, we've added wellness, we've added telemedicine, so it's a progression. And there's no health insurance that covers everything anywhere in the world. So when as we continue to grow, this is something that it's not the first time I'm hearing it, and we have taken it on board. It is quite an expensive operation, but once we get to an area of comfort, we will definitely add it on. But currently, public servants do have access to have myomectomy done simply because they are under what we call our formal sector, Ilera Eko plan, and the payment modalities and all that are different.
All right, Lagos. You've been hearing the voice of the Permanent Secretary of LASHMA, Dr. Emmanuella Zamba. Have you or someone you know ever been unable to receive care during pregnancy because of hospital cost? Share experience with us. Or do you believe government health insurance can actually work for poor? Because people are testifying. So Zamba just made a reference to the social media pages where you could watch and see these testimonies. All right. Are you also currently enrolled in Ilera Eko? If yes, what has your experience been like? You are allowed to share, positive or negative, and then the right thing will be done. Do you live in an area like Badagry, Korodu, even Yaba or Lekki, and you have questions on Ilera Eko? Come through. Good afternoon. Hello, good afternoon.
Good afternoon.
Good afternoon, Madam Oboli, by voice.
Good afternoon to you and Dr. Emmanuella.
Good afternoon.
So, I've been following the discourse since inception, and I want to say it's a laudable thing that LASHMA is doing under Lagos State. But peradventure, one gets to these facilities, and most of what she's reading out this afternoon is not true. Is there anything like a follow-up process or a compliance process where you can report to and ASAP you'd be attended to? Because before now, I don't know if it has been perfected. I've heard a couple of women say when they get there aside what they've paid, they have still built this and that. So my question is, can she rule out a place where compliance can be lodged and sure effectiveness would be, as in due diligence would be done to make sure these people receive the right remuneration or urgent attendance? I believe you got my question.
Yes, thank you. Very good question. The first thing I would say is that I think I mentioned it when I was talking. We do have a 24-hour call center, and we have toll-free lines. There is 0800 Ask LASHMA. There is 0800 Ilera Eko. There is 0700 Ilera Eko. We have WhatsApp numbers. We have numbers that you can SMS us on. We have a chatbot on our website. And we have, you can send us an email on ileraeko@lashma.com. There are we have various modalities by which you can reach out to us. We have a dedicated staff, an entire department of customer service. They take shifts. They are there 24 hours. And all we ask is that when you get to the facility, there is an issue. Do not walk away out of annoyance. Wait there and get your rights. Call us. They will walk through with the facility and ensure that what is supposed to be given to you under the benefits that you have signed up for will be provided for you. We do have instances where some hospitals will be naughty. That is one of those things. But we expect you to give us that feedback. And if hospitals when people are really, anxious, if a hospital is trying to create some level of an imaginary barrier by saying you need to pay something, and some people, let us just pay it. We expect you to still let us know, because we will penalize that hospital for collecting money that they should not have collected from you, and you will be refunded your money. That is a promise that we have guaranteed and we continue to do. So please, just your duty is to let us know. We all have our roles and responsibilities. As an enrollee, you need to know your rights. You need to know where to complain to, and you will get justice, as the case may be.
All right. Thank you so far, Dr. Emmanuella. We will be going on a short break soon, and I hope when we come back, we only have about a minute to wrap up the show. But I must reiterate that Dr. Zamba has spoken keenly on who exactly qualifies as an indigent pregnant woman under this program and how they will be identified, the type of service, including antenatal care and all of that, delivery and even postnatal care 28 days after the baby is born. With these women be linked to primary healthcare center, she did say that you have that luxury, the opportunity to pick your own hospital, so they are not mandating a particular hospital. Okay, so we've covered all of that. If you still have more questions, well, maybe we're able to take one or two more before the end of the show. Lagos State, we'll be right back.
Play with as little as 500 naira, and in a few seconds your ticket is in the draw. The more you play, the better your chances of winning every day on the Morning Crossfire, WhatsApp Lagos, and Game On shows on weekdays and the Football Frenzy shows on weekends. That's not all. Every Friday there will be a 500,000 naira jackpot. Playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same whether you play on oneplay.ng or dial *347 *880 *3#. Remember to play responsibly. Not suitable for persons under the age of 18. OnePlay is a registered trademark under LASHMA Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
To take control of the money where you dey make and wetin go happen next, na the koko of life for plenty people there. How to manage their money, they start with how them they run things with their partner. But true, plenty sense dey inside family planning. When you do family planning, you go fit to use Confido take dey run things with your partner under the moon. You go get plenty joy as money where you dey make go reach you spend, and your health and your well-being go dey protected. No tanda the look, make you join body with plenty people them. We don't discover the joy wey dey inside of family planning for Lagos. Remember, say you fit to choose from different plans wey dey available and make everything sweet for your future. Visit your health center today. Make this move now. Make your future day full with happiness and the good health. Now the Challenge Initiative, TCI, and Development Communications Network, DEFCOMS, do this message.
99.3 Nigeria Info, your number one station for talk. Let's talk.
This is
Maternity Line.
Maternity Line.
All right, Lagos, it's Maternity Line show, and we still have all the time in this world right now. Say 2 minutes to push your question forward. I have this one from Kemisola. Kemisola says, good afternoon. Okay, this is Chinwe talking about rain. I just missed that message. Okay, found this. Kemisola says, Zainab, please ask Dr. Emmanuella, is this for free? This 8,000 naira part that she mentioned the other time, is it 8,000 naira? Please ask her. Kemisola from Yanopaja.
Hi, Kemisola. I just use that figure arbitrarily. A lot of our mothers end up not spending anything. You know, there will be some peculiar things that might happen when you're going to have your baby, but generally, almost everything is covered by Ilera Eko. If you go onto our social media platforms, we're on Instagram, we're on Facebook, we're on Twitter, we're on TikTok, we're on YouTube, we're everywhere. And one of the things that we do, because we know that it is not about what we come to say to you here, it is about you hearing from other people that have benefited from Ilera Eko and are on Ilera Eko. You will listen to testimonials. They will tell you their names, where they live, and their experience with Ilera Eko. We're not trying to tell you that it is perfect, but I can assure you what you paid for, you will get.
Okay, this is Maxwell from Ikeja. He says, good afternoon. Please, can SMEs be part of Ilera Eko? Beautiful and laudable project.
Excellent. So yes, we do have group enrollment. So SMEs would fall under that. Maybe a small company. You can come on board. So we have schools, we have stores, we have different sets of people under the MSMEs that come on board, and you can come and join us. We will enroll your staff. You can choose to either enroll them as individuals, but we do recommend that you enroll them as a family. And we do, as I said before, you have the opportunity to be able to pay installmentally according to how, because everybody's not on the same level.
That's right.
Exactly. So you can pay installmentally. It's just for you to tell us how it is going to be convenient for you, and they will explain. And once you make your payments, when you're supposed to make your payments, you are entitled to the same scope of services that someone that paid upfront is.
All right. Unfortunately, we have to go. Dr. Emmanuella Zamba, thank you so much for joining us today on Maternity Line Show. We appreciate your leadership at LASHMA and your commitment, to making healthcare more accessible, more affordable, and most importantly, life-saving. And you are not just beautiful in pictures. I say that outside. Yes, seeing you in person is beautiful and gorgeous. Great to meet you in person. All right, Lagos, that was the size of the show. That has been the size of the show this afternoon. Join us again next week on Maternity Line Show. We'll be discussing preeclampsia with Dr. Lawal Kudus. Bring all your questions, okay? Let's have a discussion. All right, it's time for the news at 1, and Tife is live in the studio. Please stick around. Tife is live in the studio. Please stick around.